This is the 980, this is the newer one. And then we have an 840, which is here. We're gonna go over the 980 first, and then we'll show you the differences between the two. So our basics are that you let it start ventilating the patient. All right, so the basics that we have on here is you have an alarm silence here. It's going to be this little bell with the line through it. When you hit this, it will silence the ventilator for 2 minutes. You get a little countdown here. It starts at 2 minutes. It'll go down to 0. You can keep hitting it as needed. You also have your 100% O2, which we encourage you to do before you suction your patient. You want to hyperoxygenate them. We also encourage you to hit the alarm silence button, just because you're going to cause the reason that the vent is going to start alarming and people won't need to come running. You hit the 100% O2. It's going to give 100% on the ventilator, no matter what oxygen is already set on the vent. Deliver it for 2 minutes. It's going to start counting down here for you. You don't have to do anything. When it's done, this will disappear from the screen. The 100% will revert back to whatever the patient was on, 40%, 50%. Same thing with the silence. When it's done, the alarm is done, the silence alarm, and if the patient, something happens, the vent will alarm again. You're not like silencing it for forever, for good. We have our on-off switch here, which is like under the little thing. It's kind of like a little glass. Don't touch it. We're not turning it on and off, but that is where the switch is. And then we have, well, we'll deal with the cables in a second.
But just in case it becomes loose or somebody takes it off.
Back here, you should have a red alarm cable. That's going to go to your nurse, to the call bell, which is going to make the alarm outside the room, and it's also going to alarm at the nurse's station. The vent will audibly alarm, but if this is not plugged in, it's not going to go to the call station. So you want to check the wall and make sure it's plugged in to your cable. We do also, as part of our check, but that's also something you want to make sure it didn't get pulled out or moved or changed.
And do not disconnect it even though it drives you.
It is annoying, and you will have to reset it, but you cannot unplug it, because then we all know that that is a safety issue. You will not get alerted. The ventilator operates, we have a control mode, which means we are giving the patient the rate that we want them to breathe, the respiratory rate, the tidal volume or the depth of breath we want them to take. We're giving them their oxygen, we're giving them the PEEP. All of those things are found in this area down here. This is always what we are delivering to the patient. F is frequency, it's also their respiratory rate. When we say rate, it's under frequency for F. The VT is the tidal volume, PEEP is there, and then it's the oxygen, which is right now set at 100% on the patient. So this is what we're doing, what we want them to do. Up here in this area is what the patient is delivering. That's what they're giving back to us. Same thing, we have a frequency here, we have their tidal volume here, their peak pressures, and then you can see other things that you don't need to really get involved in. But this is always what they are doing up here, what we're delivering here. See, they're in a control mode. We're giving them, we're doing what we're telling them what we want them to do. They can still overbreathe on it, but they have a set rate and a set tidal volume. And then do you want to switch to pressure support? So then there is a pressure support or spontaneous mode. You'll have patients that are on that either we get chronic patients that are coming from facilities that are already on, maybe they do pressure support or spontaneous during the day and then assist control at night, or maybe they do trach collar during the day and they might only need spontaneous at night. Or we get a patient over that we're bringing that we're still weaning, that we're trying to get to a trach collar. Spontaneous, we are no longer setting a rate and we're not giving them the tidal volume. They are doing it on their own. It's just what it is, spontaneous. They have to be able to initiate a breath.
And an easy way to see it is you'll see
and
the
S. And now that
S
S is there and not the C. It's in a spontaneous mode. Still, we're seeing the rate. So now you're only seeing what the patient is doing, which Cheryl is using with the lung right now because we don't have a patient and they have to breathe spontaneous. And the tidal volume or the depth of the breath that the patient is taking on the ventilator is here. Now we're going to show you if the patient does not take a breath and they're in spontaneous mode, what is going to happen.
They're not getting any delivery.
They're not getting any delivery. The patient is either they're tired, they need to go back on. They're going to usually go into what we call apnea ventilation. We need to be notified about it, but you need to know that the vent always has a backup setting. The vent will kick in. What it will show you is just what it is: apnea ventilation in progress. It's telling you on the screen and it's going to alarm and it won't stop alarming, but the patient is now in the backup mode, the settings that we have provided in there, so the patient is being ventilated. You just need to call respiratory and let us know the patient is in apnea, and we will come and we will put the patient back in the control mode, but the patient is being ventilated. It's telling you on the screen.
Now, it won't switch back to spontaneous.
It will not switch back. Now, if the patient picks up a breath, it will come out. But it's good for us to know that the patient went into apnea, and then we'll make the determination of whether we want the patient to go in.
Now it's out.
So we might get back up there, but we'll be able to also look in the log and see that the patient went apneic and that you had apnea. Also, it will kick in if the patient goes apneic for more than 20 seconds. That is when the ventilator will kick in into apnea mode. We'll show you do you want to go back to system control before the disconnect?
Yeah.
Or?